Here are a few things you need to know about chlamydia in men. The majority of cases of chlamydia in men are asymptomatic, with only 10% of men experiencing symptoms. When symptoms do show up, the most typical are frequent urination, burning or pain with urination, dysuria, an itchy feeling near the opening of the penis, watery, white discharge. More rarely, chlamydia can infect the epididymis, which is the coiled tube filled with sperm attached to the back of each testicle. This can cause scrotal swelling and/or testicular pain on one or both sides. It is thought that chlamydia may also be one of the organisms that contribute to chronic prostatitis, which is long-term inflammation of the prostate gland. Introduction to chlamydia infection in men. Chlamydia is a sexually transmitted infection (STI) caused by the bacteria called Chlamydia trachomatis. When you learn about it in school, it's typically mentioned alongside gonorrhea, syphilis, herpes, human immunodeficiency virus (HIV), and human papillomavirus (HPV). However, chlamydia is far more common than the other STIs, with the exception of HPV, with an estimated 1.7 million cases reported to the Centers for Disease Control and Prevention (CDC) in 2017. This makes it the most common reportable bacterial infection in the United States. Part of the reason for this is that chlamydia is most often asymptomatic, which means you or somebody you know may be infected without even knowing it. How is chlamydia spread? Chlamydia is transmitted from person to person through sexual contact. More specifically, chlamydia is spread by touching the anus, mouth, penis, or vagina of an infected person. This includes having anal sex, oral sex, and vaginal sex. Chlamydia cannot be spread through kissing, mouth-to-mouth contact, but an infection of the throat can spread to a partner who is receiving oral sex. The risk of getting chlamydia can be reduced by using methods that form a complete barrier between partners. This includes using a polyurethane or latex condom or a dental dam during all forms of sex. Barrier methods that do not entirely block contact, such as the diaphragm, are not effective at preventing STIs. Similarly, other types of contraception, like birth control or spermicidal lube, do not prevent the transmission of STIs. What are the signs and symptoms of chlamydia in men? As mentioned, the majority of cases of chlamydia in men are asymptomatic. In fact, it is estimated that only 10% of men do actually experience the symptoms of chlamydia. Even in those who do, signs do not show up immediately. It typically takes about 5 to 10 days after exposure to chlamydia for symptoms to begin. When symptoms or other complications are present, chlamydia is known as a sexually transmitted disease (STD). Chlamydia can affect different parts of the body. Let's talk about them. The most common area for chlamydia to infect men is in the urethra, the tube that runs along the inside of the penis. Infection of the urethra is called urethritis. In medicine, it is also sometimes referred to as non-gonococcal urethritis, which means urethritis that is caused by something other than gonorrhea. The most common symptoms of urethritis are frequent urination, burning or pain with urination, itchy feeling near the opening of the penis, scant, watery, white discharge as opposed to the more voluminous, pus-like discharge of gonorrhea. You may experience all, some, or none of these symptoms. The discharge may be seen as a dried film on the tip of your penis if you have not urinated for a while, or as a stain on the inside of your underwear. Secondly, let's talk about the effect of chlamydia on the epididymis. More rarely, chlamydia can infect the epididymis, which is the coiled tube filled with sperm attached to the back of each testicle. Infection of the epididymis is called epididymitis and can cause scrotal swelling on one or both sides, testicular pain on one or both sides. Thirdly, the prostate. It is thought that chlamydia may also be one of the organisms that contribute to chronic prostatitis, which is long-term inflammation of the prostate gland. Symptoms of prostatitis include pain with urination, pain with ejaculation, incontinence, difficulty urinating, and pelvic pain. Fourthly, the rectum. If you engage in receptive anal sex, you are also at risk for developing proctitis, which is infection and inflammation of the lining of the rectum. When caused by Serovar's decay, proctitis is often asymptomatic. However, proctitis in men sleeping with men has been seen with Serovar's L1, L2, and L3. The same Serovars that cause lymphogranuloma venereum, and this can be a much more serious condition. Symptoms include rectal pain, rectal discharge, rectal bleeding, constipation, tenesmus, which is the sensation of needing to have a bowel movement. How is chlamydia diagnosed in men? To diagnose chlamydia, a sample needs to be taken from every area that is at risk of infection. This is determined by the type of sex somebody engages in or the symptoms he or she is experiencing. In men, a urine sample is typically collected. Healthcare providers often specify that this should be first catch, to indicate that urine from the beginning of the stream should be included in the sample. However, one study in women showed that first catch urine is not as important as suspected, since the test for detecting chlamydia, known as the nucleic acid amplification test or NAAT, is effective enough at identifying the disease anyway. If a man has engaged in receptive anal sex, a rectal swab may be obtained. Similarly, if a man has engaged in oral sex, a throat swab may be obtained. How is chlamydia treated in men? Chlamydia is treated with antibiotics. If you are exhibiting symptoms or you have a sexual partner who already tested positive, it is likely you will be given treatment even before your test results come back. This is called presumptive treatment. The most common antibiotic given by a healthcare provider is a single dose of azithromycin, brand name Zithromax. If there is a concern for a possible co-infection with gonorrhea, a single injection of an antibiotic called ceftriaxone, brand name Rocephin, is also given. This is typically the case when treatment is presumptive. An alternative treatment regimen is a 7-day course of doxycycline, brand name Vibromycin. This replaces the single dose of azithromycin. In cases in which epididymitis is suspected, doxycycline is prescribed for a 10-day course, and if LGV is suspected, doxycycline is prescribed for a 21-day course. Remember to like and subscribe to this channel for more health tips. Visit MOXIBER.com now to read more on this topic.